We're now live. You can go ahead.
Okay. Muy buenas tardes y gracias por
Hi,
acompañarnos.
good afternoon, and thank you for being here with us today. This is Sylvia Lemos, specialist in communications for the County of Sonoma, and this is an update on the COVID-19 for September 2nd, 2021. So there's a message for everybody who speaks English.
Which is being conducted in the Spanish language. To listen to this presentation in English, please visit the County of Sonoma YouTube channel, where we will be live streaming to English. You can find the link in the Facebook post to this announcement on the county's Facebook page. Thank you. Y ahora también les voy a pedir a todos que...
So now I'm going to ask also to please speak slowly because we have interpreters that are trying to help. We have very good news to share with you. First, our campaign for vaccinations is getting close to the 75% of people that are fully vaccinated. And today, more than 74% of the residents of the Sonoma County of the age of 12 years and up have been fully vaccinated, and that's a great advancement. That's great progress. That number keeps growing every day, and we are still working to try to get shots in arms. So if we continue with the 8%, there's another 8% of people that are partially vaccinated. So we don't have that much left of the population left to be vaccinated. So at least with the first vaccine, there's people are being saved. There's lives being saved with the first vaccine. So which means that the vaccine is saving lives, and it's not an exaggeration. The CDC is saying that people who are not vaccinated have 29 more times of a chance of dying from COVID than people that have been vaccinated. So most of the people who have people who have passed away from that have been vaccinated have passed away, but they died from other ailments and not from COVID. Also, we have the variant, the Delta variant, that has been growing. Our 19.5 of our numbers of a percentage of people that is for every 100,000 inhabitants in the county of Sonoma. So, so for the people that are not vaccinated, and 5.9 is for the population that has been vaccinated. So if there's another way to measure the effectiveness of the vaccine, we will try to put forward our cases and show you the updates that also the schools. And so first I'd like to let Dr. Enrique Mendez to give us a summary of the pandemic in the county.
Doctor, no se escucha, no sé si prendió su micrófono. Doctor González, no se escucha, no sé si su micrófono está trabajando.
Sí, disculpe.
Está bien, gracias.
Oh, sorry.
Sí.
Yes.
Gracias.
Thank you, Sylvia. Really, I had a little bit of a problem there, but I'm fine now. Well, it's been 3 weeks of the new since opening school. You know, the classes in person, full time in school. For you know, there have been a lot of questions in regards to the security and the safety of the classes and being in person. Since the classes began, we that 65 cases in the elementary schools, 12. Sorry. 16 members of the personnel in the total of the schools have been affected, have been tested positive for COVID. So he's having problems again.
¿Está bien, doctor?
Sí, es que estoy teniendo aquí un poquito de dificultad con mi computadora.
He's having difficulties with his computer, so excuse us for a little bit. So, like I was saying, the most of the cases, the surge have of the transmission has been was not known, and only 10% were. Only 10 cases were known to be contagious in the campus and school. So um, usually the virus will only become more contagious when there's a lot of people, reunions of large people. So that's where most of the time where the most of the cases have been, the positive cases have come from. We want the cases to keep going down, and that's why the county has put in new safety recommendations. You know, to use the masks for all the time, even though they're outside or inside, not just inside, but also outside. It's also a recommendation, and that's another strong recommendation also for excursion tours or when the kids go outside, just to have their mask on at all times. The the Pediatric Association and the CDC, they support that we use masks at all times in the schools to protect also those who are not vaccinated from COVID-19 and to reduce the transmission. While we recognize that uh, a large part of the population that are students still have not been vaccinated, either for a reason that is a personal reason or some other reason, or they haven't done it because of their age. So with these measures in place, we think that we can have a great school year that's productive. And so the best tool that we have to maintain our community is to have the vaccine. And so I invite everyone that they can get the vaccine to go ahead and go get vaccinated today. I also like to talk about the testing of COVID because there's a high demand. They've gone up. The demand of testing has gone up about 38% just in the last month. So the county has responded to this need by increasing the testing from 1,000 to 14,000 tests um, per week. So just to know where the testing is happening more in the county, we recognize that it could be hard to get a test um, for COVID. So I invite you to please look at the calendar in our website and socalemergency.com .org to have a list, a complete list of the different places where you can go and have your testing done, and not just for you, but just and for your family. Also, we keep pushing our campaign for people to get vaccinated. So we're almost at 75% of the population in the county of Sonoma that are fully vaccinated. That is a huge success. And so if we look at the demographics of the population that's vaccinated, we can see where we still see people where the voids are. So usually people that are 70 years or older, about 95% of them are vaccinated. And that has made a huge difference to control the surges, especially in installations or clinics and medical offices. 75% of our population, the 35 to 70 years old, has also been fully vaccinated, and about 85% has been at least partially vaccinated. So that's again a great step forward, a great progress. So we still need more. So we still need for those who are younger than 35 years old that are population for our population that are 16 to 34 years old. 63% of them have been vaccinated, and our population that are 12 to 15 year olds, a large population of them have been vaccinated, even though we just started giving out those vaccines. So we're starting to see a great number of more cases that are the variant, the Delta variant, on the younger people in the hospitals. So it's very contagious. So the people that are young and have not been vaccinated and have been, they have now endured, they're starting to get sick. They're starting to get contagious, and that's why it's important for everybody to get the vaccine. The vaccine is it's effective, it's free, and it's available just about anywhere in the county. So also, you know, there's a lot of providers that can get in pharmacies where you can get the vaccine. A lot of mobile clinics, um, pop-up clinics everywhere. You can find out. You can find in SoCo at the website soco.org vaccine/vaccine, and you will find a list of all the different places where you can get the vaccine. So in the meantime, we keep waiting for the approval for the vaccine for kids that are younger than 12 years old. And so we want the FDA to work on this in the next couple of months. And so, which would give us a great tool, a very powerful tool to combat COVID-19 with younger people. So thank you for your attention on this great, important information. And hopefully in a couple of weeks, we'll be back with more information for you too. We'll give it back to Sylvia. So now we have Priscilla Rodriguez, who's a nurse practitioner in Sonoma, who's going to share a message from Dr. Chilich. Thank you, Doctor. Thank you, Dr. Gonzalez. This message is from our doctor. He's a director of the hospital Providence here in Sonoma. These are his words. My message is similar from the one that I've sent in the past. It's the same frequency of that, like I said before, you need to get vaccinated. And if you have been vaccinated, talk to somebody who has not been vaccinated and try to share with them what the experience has been with you. And our hospitals, August was a month where we had an increase of patients with COVID. The number of patients that are in the hospital compared to what we saw in March and July has doubled since what we had before. So additionally, in August, we saw the second most highest number of patients since the pandemic. So looking back, we've seen that 89% of the people who passed away from COVID in the hospitals were not vaccinated. So our nurses are talking to patients and a lot of the patients have some patients have been vaccinated and they're doing well. So let me talk to you about the importance of being vaccinated. The vaccines are good, they're effective, and they help combat the vaccine. Also, the other thing that helps too is to get tested, especially if you have symptoms. If you have contact with people or you've been contacted by someone who has the symptoms or has not been vaccinated, this is important to find out about the early detection of the virus in the system. And so also try to keep up with washing hands. And I want to remind everyone that are watching us or hearing us or listening to us that if you have autoimmune problems and you've already had Pfizer or the Moderna shot and you have passed already more than 8 days since you had the second dose, that talk to your primary doctor and try to talk about the possibility to get the booster shot. And so that's a third shot. So patients with the immunological compromised immunological system might need, or people that have cancer, or people who receive the organ transplant, or that take different type of medications that are suppressants for immunology, or that are immunodeficiency. Um, Try to talk to your doctors and try to get, and even patients with AIDS, also try to talk to them about getting Um,
recibiendo alta dosis de esteroides o medicamentos inmunosupresores.
try to talk to your doctor about that too. So
So
we can beat the COVID-19, but we're gonna need a collective effort by the community, and that includes getting vaccinated, to be assured that we use our masks when it's necessary, washing your hands regularly, and to get tested if it's necessary. Thank you for your time and your for listening to this message,
Gracias, Priscila, por
and
ese
I really
mensaje que
appreciate it.
compartísele al doctor Privileges, porque es información importante de que
Thank you for passing on that message from the doctor. It's a good thing to have to share with everybody else. And also we're going to talk to Raman Hauschner, who's part of the team for the epidemiologist here in the county of Sonoma. So we're also going to ask Priscilla, see if she has got anything that she wants to add to the information that's going to be given.
Slides, un momento. Lo voy a comenzar. Lo voy a compartir también. Un momentito. Ok, y ahora para compartir. Aquí está. Ok, siga, por favor.
Gracias, Silvia. Primero, vamos a...
Thank you, Sylvia. So I think we're going to talk about the tendencies here in the county.
La tasa es, hay ahora 19 nuevos casos por cada...
There's
100
19 new cases for every 100,000 residents. That's 4.8 of 4.8% of people that are in the county.
Más bajo del HPI. Las hospitalizaciones están elevadas en este momento. Hay 75
There's 75 patients that are hospitalized, and there at this time there's 41% who have passed away from COVID-19 since the 1st of June.
Y mirando la
And looking at the different populations and of the people that have not been vaccinated, 23% of the people have 23 people per day. And so from the people who are vaccinated, only 4 cases for every 100,000 people.
Iba a interrumpir un poquito. No miro las diapositivas, no sé si las pusieron, no se miran.
¿No se miran?
No. ¿Lo pueden ver ustedes? Si podemos poner para poder ver.
No se ven. Ok, déjeme ver
No
a ver
se
qué
ven.
estoy haciendo. Un momento. ¿Ahora sí se ven?
They're trying to share this one. There. Here we go.
Oh, disculpen. Okay.
otra vez que puedes ver en la naranja es la población.
So
no
the
vacunada.
orange line is the people who are not vaccinated, and people there's 23.9 cases for every 100,000 people. The other line, the blue line, is those are the people who have been vaccinated, and that's 4.7 of new cases per 100,000 people per day. Here we have the measurements of the last 60 days by the ethnicity groups, by ethnic group, American Indian, Alaskan. So the Native Americans have the highest rate for every 100,000 people.
Después es el grupo de afroamericanos, isleños del Pacífico, Latinx.
So yeah, Latinx is the orange line there, and you see all the numbers on the right side are also the totals of all the different ethnicities. These are this is the testings per day. We have a volume of about 494 0.7 tests per 100,000 inhabitants, residents. The testing has increased in all races and ethnic groups, and age groups and geographic groups throughout the county. The graphic on the left side, these are the groups, the age groups, and we can see that from the last 60 days that the group that has the highest cases is the group of the age of 20 to 29 and then 30 to 39. And on the right side, you see all the other ages, and the graphs will show you how each group in the last 60 days or the last months, how they've gone up and down, how they changed. This is the highest transmission has been happening at home. That has been the surge of transmission has been the most common one. When people get together, large gatherings, or places of employment too. The large reunions also represent 8.5, or I can't see the number. This is for the fall, the cases, number of cases for the fall. This is the ones related to the schools, 107 cases in elementary, 65 cases in intermediate school, and 28 cases in high school. Less than 5 cases in special education. This total includes 182 cases are students, and 19 cases are personnel or staff.
La mayoría de estos casos,
most of these cases are 53% of these cases were not known where the exposure came from, was not verified. 26% was families. 15% of the cases were people that were not sure, but they thought that it might have happened at school. There's small documentation on that, and 3% are where people were exposed in communities. 3% were playing sports or during sports, and less than 5% were related to travel. And 75 patients have been hospitalized since 31 of August up to 31 of August. 19 of these people who have been hospitalized, and they are in the ICU units. And since the 31st of August, the amount of people have been increasing in the hospital, especially people in 50 through 64 years of age and 18 through 49 years of age. Most of these people that are being hospitalized are people who have not been vaccinated. People who have been completely vaccinated usually are people who have underlying conditions and are older in age.
Próximo, por favor.
Next.
Y ahora en todo el condado.
So now this is the county-wide number of vaccines. And now there's more than 320,000 people who are completely vaccinated, and 34,000 residents that are partially vaccinated. So that's a 74% that are fully vaccinated and 8% that is partially vaccinated.
La tendencia de la
Here's the tendency of the trend of by groups, by age. So there's you can see the age groups that are the youngest group is the one that's increasing the most than other groups.
En esta gráfica puedes ver la proporción de población vacunada dentro de cada grupo de raza o etnia. Una proporción menor
Sorry, I
de
was coughing.
latinos y multirraciales están completamente
Here's the
en comparación a otros grupos raciales.
the different ethnicities of groups that have been vaccinated by ethnicity.
Tuvimos un nuevo
This week we had
personas vacunadas.
more than 1,000 people vaccinated. So that was the total 56,000, 56.537. So that's an increase of 1.8%. So we're looking at the equality of the county throughout the different quarters of the county.
Administrado a los residentes en el cuartil más bajo del índice de lugares saludables en el que los residentes tienen acceso a la menor cantidad de
This is
recursos.
where people have less access to the vaccine or to the resources. So most of the people are in this quarter of the county. And so this is where people are less partially vaccinated. 8% of them are 8% have been partially vaccinated, and 64% of them have been fully vaccinated. That's all. Thank you.
Gracias. Ahorita regreso. Voy a terminar de compartir la información.
Thank you for sharing all that information.
Ok, muchas gracias, Robin. Y ahora con eso terminar nuestra presentación.
So with that, that's the end of our presentation, but we'd like to thank everybody who participated with this information that's so important about with this update for this Thursday, September 2nd. And thank you for all the people who joined in from our communities, and also our interpreters, Elizabeth and Juan, who helped us with the interpretation today. We wait for you on the next couple of weeks to share more information with you. Good night, and thank you for joining in.